Smooth 98.1. Love music, love life. You are welcome to the Smooth Drive. Better still, the Smooth Health on the Drive, right here on Smooth Drive. My name is Judith TV.
I'm Kaidi Baker, and don't forget, Smooth Health is brought to you by Evercare Hospital. So in the studio today, we've got a very, very, very special guest, and we would love for you to be a part of our conversation. So if you're out there and you want to reach out to us, you know what to do. If you don't, however, let's tell you, 0809 444 0981 is where you can send your WhatsApp messages to for questions. However, you can call the studio lines. We're giving out vouchers to the first 3 callers, okay? So call the number 01448991 to be a part of the conversation.
Yes, indeed. Again, if our first 3 callers today stand a chance to win 3 tickets, 10,000 naira worth of vouchers, courtesy Evercare Hospital, and that voucher goes to your first ever consultancy at Evercare Hospital. Now, today on the show, we'll be discussing the topic prostate enlargement, and I have with us today in the studio Dr. Ifedayo Adejare. He's a consultant urologist, and he has over 20 years of experience in medical care, in medical practice, 8 of which have been as a urologist. His key areas of clinical interest and expertise are benign prostate enlargement, prostate cancer, and male factor infertility, and so many things that I obviously cannot pronounce because of the medical terms. So he's going to give us all that information. He's also skilled in several minimal invasive urologic operations, including bipolar TORP and laser treatment of kidney stones. Dr. Ifedayo. Thank you. Ifedayo. Welcome to the show.
Welcome to the show. Good to have you here.
Thanks.
So let's just dive right into it.
Thank you.
Welcome to the show. Okay, so let's talk about this. Who is a urologist? And also, what are the services that you offer at Evercare Hospital?
Right. So a urologist is a specialist doctor who treats men and women with problems in the surgical problems in their kidneys, in their ureters, in their bladders, that's the urinary tract, and also men with surgical problems in their genital tract, the prostate, the penis, the testicles, etc.
Okay.
Yeah, that's essentially what a urologist does.
Are there lots of urologists here in Lagos, Nigeria, or Nigeria in general?
Oh, yeah, very good number.
Very good number.
Yeah, because urology is a very, very busy field.
Okay.
Extremely busy.
So please tell us what is prostate enlargement and what are the causes of this condition? Yeah,
so, prostate enlargement is probably the most prevalent, the most common urologic disease you find there in men. It's a condition of the prostate. And the prostate gland, I'll very quickly just tell you about it. It's a very small gland underneath the bladder. Okay. Which essentially serves a sexual function, helps to lubricate sperm and all that. Okay. When a man gets older,
it's okay to be very, very,
graphic.
I will be a bit graphic.
Yes. Yeah. So we like to educate the people as best as we can.
Obviously. So when a man gets older, this gland tends to grow larger and larger. And so it's the definition of prostate enlargement is essentially in the name. Prostate gets bigger with age.
Okay, but is it like a natural thing? Is it supposed to always grow bigger, or is it what's the process like?
So essentially in most men, as you're getting older, from about the age of 30 or so, the prostate begins to get bigger, like under the microscope. If you look under the microscope of a 30-year-old man, you'll see that there's evidence that the prostate is getting bigger. By the time a man is in their 40s or 50s, some of those men will already begin to have actual enlargement that you can see or feel. And essentially, if you see a man in the 70s or 80s, the vast majority of those would have an enlarged prostate. So while it's not, you cannot term it a natural process because it's an abnormality. Okay. But you essentially almost impossible for a man who lives long enough to escape it. It's almost impossible.
So it's all men are prone to this?
All men.
Oh, wow.
Except those who unfortunately don't have testicles, which, is not desirable.
So studies have shown that a high proportion of adult males have the symptoms as they grow older, like you've said. But what are some of the symptoms of prostate enlargement?
So essentially, the first thing we must realize is that many men have prostate enlargement with absolutely no symptoms.
Okay.
Wow.
Yeah. The vast majority of men with prostate enlargement have no symptoms.
So how then do they know that it's larger?
Yeah, so those men would not know except they go to the hospital to check for something else, and their doctor says, "Oh, you know what? Let's check out your prostate." But for those who have symptoms, who are not in the majority of those with prostate enlargement, but because of the number of men with prostate enlargement, those men are actually very many in the community. The symptoms are one, frequent urination at night. You know, a man waking up more than once. That's a sign that something may be wrong with the prostate, especially anybody above 50. We're not talking about men above 50.
Okay.
Right, so frequent urination at night. Now, in the daytime as well, a man going to the bathroom more than every 2 hours, something might be wrong with the prostate. If you cannot hold your pee and you have to find a bathroom, anywhere you get to, public, private, the first thing you're looking for, where is the bathroom, where is the nearest bathroom? Something might be wrong with your prostate.
Okay.
If you're taking too long to empty your bladder, you go to the bathroom and you, instead of spending 30 seconds and getting out, you're there 1 minute, 2 minutes. Something might be wrong with your prostate.
Wow.
If you cannot empty the bladder completely, you're there and you think you're done, and then you dressed up, you're out, and in 5 minutes you're back again because you're not done completely. Then something might be wrong with your prostate.
And this is peculiar with men above 50?
Especially men above 50.
Oh, wow. If you're out there and you want to be a part of the conversation, you've got questions for our doctor, please feel free to reach out to us once again. Call the studio lines 0144899981. In the studio, we have Dr. Ifedayo Adejare, he's a urologist, and we're talking all about prostate enlargement. Now, we asked the question earlier that what kind of services do you offer at Evercare Hospital? So let's marry that into, prostate enlargement. I don't know why I say prostate.
What is the procedure for just diagnosing prostate enlargement?
Yeah, so essentially men would ordinarily come with some of those symptoms I mentioned, and if they have some of those symptoms, they will get an examination by the urologist to see if the prostate is enlarged or not. And following that examination, we then do a couple of tests to confirm our findings. Some of these tests include an ultrasound scan to measure the size of the prostate, the precise size of the prostate, to see things like if there's retaining urine, or if there are things like stones, etc. in the bladder. And then we do blood tests, to check that the kidney is functioning properly. And then we check urine to be sure there's no infection, things like that. And then subsequently we just look. There's a very special test called the PSA.
Okay.
Right. That test, we use it to see the risk of identifying cancer in that individual. Because there's a bit of confusion out there in the public.
So glad you're saying this, because I was going to ask, because I know a good friend whose father died from prostate cancer.
Yes.
And so he's had to go through that test. And then he's quite young, but they said he was enlarged, but he wasn't cancerous. And it was very confusing, So what is that difference? There's a thin line, isn't there?
No, there's no thin line. It's very different. There are two different conditions occurring in the same organ.
Okay.
And it can occur in the same man.
Wow. We do have a call here. I need to pause your thought there to get this call. Hello?
Yeah, hello, good evening.
Good evening. You're a first caller today. Your name, where you're calling us from, please?
Okay, my name is Israel.
Israel calling us from where?
From MKO Abiola.
All right, Israel. Go on with your question, please.
Okay, I would like to ask a question. Now, does anyone below that age, the particular age you mentioned, what if that person, some of the symptoms you mentioned, frequent urinating and all of that, if that person below, let's say 35, 40, sees that symptom, is the person likely to probably have a prostate issue when he's above that age?
Well, thank you so much, Israel, for your question there. We're going to get Doctor to answer. Thank you for calling.
So, Doctor?
Yes.
Go on.
Yeah, thank you, Israel. Very nice question. So, I mentioned that men above 50 are the most prone, but I've also seen men below, and let me not say urologists regularly see men below 50 with prostate enlargement. But it is not as common as it is in men above 50. So my advice would be for anybody who's got those kind of symptoms to get checked out to find out what the real cause is. There are a few other causes of such symptoms in men, not just prostate enlargement, but just to mention a few. In the older men, I'll mention a few like prostate cancer. That's the second other thing that could cause that. And then there's a condition of the bladder where the bladder is just too active. Therefore, the person cannot hold pee. We call that overactive bladder.
Okay.
So those conditions can occur. And also, younger men have injuries to their urethra. That's the pipe that leads from the bladder out.
Okay.
And that can narrow that and cause a stricture. So that's much more common cause in younger men.
All right.
But obviously, we do see prostate enlargement also in younger men.
Let's see who this is. Hello. Good evening.
Hello. Good evening.
Good evening.
Hi. Good evening.
Yeah, my name is Suleiman. I'm calling from Apapa.
Suleiman
from Apapa. Suleiman, go ahead with your question.
Yeah. So I'm a young person and I drink a lot of water in the morning before going out. But when I get to the office, just like maybe 1 liter, and then when I get to the office, I pee and pee and pee, and then there's this dribbling of urine after my long peeing, of course. Or sometimes I find myself going back again, like I find that I've not completely emptied everything. Is there like a difference between? Is there like a difference from that with prostate and enlargement and stuff?
Okay.
All right, Suleiman, thank you so much. The doctor's going to answer your question. You can be part of the show, and I said WhatsApp message to 0809-444-0981. Again, 0809-444-0981. That's our WhatsApp number to send questions. You can also call us up on 01448-9981. Again, 01448-9981.
By the way, we're giving out vouchers, courtesy Evercare Hospital, to our first 3 callers. So I know that Israel called in first. Israel, so please send in your details so you can get the voucher that we talked about. As well, Suleiman, you also just called in as well. Send your details as well to our WhatsApp number, which Judith just mentioned, 0809-444-0981. So, Dr. Ifedayo, you want to respond or react a little bit to what Suleiman just said?
Asked.
Yes, I will. Thanks, Suleiman. Excellent question. Just to quickly say that it's difficult to give particular advice to you over the radio because I would obviously need to examine, run tests to know what is wrong. But as a general piece of advice, usually 2 to 3 liters of water a day is adequate. So if you have any of these symptoms, what our advice is, try and get checked out to be sure what is going on. It may or may not be prostate enlargement. It's impossible to say over the radio.
Okay. So, Suleiman, you got that. Just visit Evercare and then you could get that checked out. Hello. Good evening.
Hi. Good evening.
Good evening.
My name is Akin from Tulare.
Akin from Tulare, you are last winner for today. Congratulations. You've won yourself a 10,000 naira worth of voucher courtesy Evercare Hospital.
Really?
Yes, you have. Yes, you have.
Thank you.
All right,
so go on with your question.
So my question is kind of different. So for me, I drink a lot of water. A lot. So take the small bottle of, the 75cl bottle. I can run through 10 in a day at least.
You can run through 10?
Through 10 bottles. That's the very least I would run through. So sometimes I can go as high as 12. So my question now is, if the bladder is too active, is that a problem? Because what that does to me in the office is I go to the toilet as many as 10 times probably, because I drink 1 to 2 bottles every hour. So my question is does that put too much stress on my bladder?
All right. Well, thank you so much for calling there, Akin. Doctor.
Yeah, thanks, Akin. Thank you for your question. That's a lot of water to drink in a day. 7.5 liters. What? That's quite a bit. Generally would advise that within 2 to 3 liters, because we live in a tropic country. It's hot, you sweat a lot. That should suffice. So perhaps you could toned down a bit. What I generally advise people is don't take more than 2 or 3 liters of water in a day, and gauge your water intake by how thirsty you are. So if you're not thirsty, no need to drink.
Okay.
If you're thirsty, get some in. If you take that much, you're going to spend a lot of time visiting the bathroom, honestly.
All right, we need to take a break here at this point.
Yes, let's do that. So please, we'll get back after the short break. Don't forget, if you want to be a part of our conversation, now's the time to take down the number 0144899981. We see messages from Ali, Roti, a couple of other messages as well. We'll get back to them when we get back after the break.
Smooth 98.1, love music, love life. You're welcome back to the second half of Smooth Health on the Drive, brought to you by Evercare Hospital, Lekki. We're talking prostate enlargement with Dr. Ifedayo Adejare. I'm surprised when I saw your middle name, Adejare. And I wanted to ask after the show, but I'm just going to put it out there. Your middle name is Igbo.
Yeah, apparently.
Okay. All right. You want to give us backstory to that?
No, there's no backstory. I mean, I'm a full Nigerian. I have backgrounds everywhere.
Yeah.
State. Yeah.
Oh, okay. That makes a lot of sense now.
Absolutely.
That makes a lot of sense. Okay, so we're still asking questions on prostate cancer. Enlargement,
not cancer.
Yes. And like we mentioned, we've got a few messages here. One from Roti, one from Ali. I think we should jump into the messages first,
yes,
right?
Please.
So this one says, question for Dr. Ifedayo Adejare. Is frequent nighttime urination always due to an enlarged prostate, or are there other causes? And okay, so that's
a question from Roti there.
And also, this one is from Ahi from Yaba. It says, want to ask what the procedures for removing prostate and how expensive is it at Evercare?
That's it. That's the questions we have there. You can be part of the show. Call us up on 014489981. Again, 014489981. Our first 3 callers today were Israel, Suleiman, and Akin from Sulere. You can send your details to us on 0809-444-0981. Again, 0809-444-0981. Doctor, we've gone way above script, but to answer, let's start off with Ronti's question. Frequent urination at night.
Yes, so thanks, Ronti. Frequent urination at night, like I mentioned earlier, it's not always the prostate that's responsible. There are other things that may be, like I mentioned, it could just be the bladder is just being too active. In fact, I forgot to mention bladder stones, even stones in the bladder could cause that. Yeah. Infections in the urine could cause that. Diabetes. Those who have nerve diseases. Some people will be spinal cord injured, etc. So there's a plethora of causes. There's so many. That's why it's impossible to ever make a diagnosis without seeing the patient.
Yes, you have to see the person.
You have to see the person and examine and run tests.
Okay, so but can we have an idea of the kinds of tests that these people might get?
Yeah, so I mentioned a couple of them earlier. Ultrasound. Generally, we do an ultrasound. We do a PSA, that's a blood test to see if there's a risk for prostate cancer.
Okay.
And then we check the urine to see if there's an infection. There's a test called flow rate where the person goes to pee into a machine that measures how fast
the person
urine.
is peeing.
Yeah. And then if necessary, not everybody, we examine the interior of the bladder and the urethra. We do it with cystoscopy. That's called a cystoscopy. It's a special test with a camera and light to look into the bladder to see what the prostate looks like. And essentially, that's what we do.
All right.
So, doctor, to go back to that question before we started taking the calls, it was about insinuations that prostate enlargement can be hereditary or traceable to family history. But please enlighten us on this.
Yes, so there is some degree of hereditary tendency with prostate enlargement, especially if you see a very young person in their 40s. I've seen a couple.
Okay.
Their 40s, 30s, who've got prostate enlargement. Often when you ask them, they say, oh yeah, by the way, my dad also had this issue, or an uncle did, or someone did. Someone who is a first degree relative, a man in his family did. So there is some degree of hereditary, it seems. But by and large, most people with prostate enlargement just develop it because they are men and they have a prostate and they have the hormones in their body that can lead to the prostate growing, and when they reach the right age, well, in quotes, the prostate start growing.
Can I ask this? Is it possible, though, that someone maybe above 50 would be unaware entirely that they have a prostate enlargement? Is it possible?
Absolutely.
All the way till maybe 60?
In fact, all the way to 80 or 90.
What?
Okay.
Yeah, if they live long enough and they have no symptoms and they don't get checked out for whatever reason, it could happen.
Okay. But
it's not likely anyway.
And what are the drawbacks to that?
So if the prostate is a little enlarged and it's not causing much of a problem, absolutely nothing would happen. But the problem comes if somebody has symptoms and he ignores them,
okay,
and doesn't seek help, and the symptoms persist, and then complications arise, and some of which I mentioned, bladder stones, for instance, can arise due to prostate enlargement, infections in the urine, and the worst of them all, the most severe, most painful, which is not being able to pee at all.
Okay.
And which then leads to men wearing catheters. Very nasty stuff, I tell you.
Oh, wow.
Yeah.
So
and then just one more thing, your kidneys can fail if you've got prostate enlargement, you don't attend to it on time. The bladder can fail and not be able to function anymore. So essentially, men with these symptoms need to get checked out and need to get treatment.
Wow, it sounds very scary, but I like the way you put it, though, because it's important to get checked out, right? We got a few more messages here. Cruz got a message in, and also Isaac. Okay, Cruz, let's take a message from Cruz.
This is Cruz. He goes, is there any correlation between gray hairs on one's head and prostate enlargement? You know how behavior of one side of the body is an indication of another problem. All of our gray hairs are mainly courtesy of last giddy traffic. That's what I was asking.
I had to laugh. Sorry, I found that a bit funny. Thanks, Cruz. So, I'm not sure if there's any study that correlates gray hair with prostate enlargement. I'm not aware there is, but obviously, again, it's the guys who have gray hair who are prostate enlargement. So
it's a no-brainer there.
Yeah.
This message is from Vincent. It goes, hello, Dr. Ifedayo. My question is, how fatal is prostate enlargement, and is it terminal?
Thank you, Vincent. I think this is a very important question. So as long as you attend to prostate enlargement on time, it is not supposed to be a fatal disease. People can die from prostate enlargement, but that shouldn't happen in 2021. That could happen 100 years ago. Definitely, because nobody knew. If somebody cannot pee for 3 or 4 days, eventually they'll go out and pass on. That's 100 years ago. Right now, even if you cannot pee, there's treatment for you that is effective. That shouldn't happen. Yes, but it can happen.
Final question, though. We want to know this. What are the treatment options available for prostate enlargement at Evercare Hospital?
So at Evercare Hospital, we offer a wide variety of very modern and very effective treatment. Generally, and I will speak in general terms now, prostate enlargement can be treated with medicines.
Okay.
And with operations, minimally invasive and non-minimally invasive operations. So essentially, most men, the vast majority of men who have symptoms of prostate enlargement will respond to medicines. And the medicines are safe, they are effective, are readily available. So the vast majority of patients I see take medicines and they're fine. And we just check them out every 3 months to be sure they're fine and that they're not developing any complications, and life goes on.
Is there a duration, though, for the time?
Oh, no, treatment is lifelong.
Lifelong?
Yeah, because what the medicines do, essentially, is twofold. One is to relax the muscles around the prostate, allow urine to flow freely. And the other is to sort of slow down the growth of the prostate or shrink it. So, if you stop the treatment, the effects will be lost and all these things will
come back as it is.
So the treatment is lifelong, essentially, with medicines. But there's a relatively smaller percentage of men with complications from the prostate enlargement, and these often do require some form of surgical treatment. And this surgical treatment in modern days now is essentially non-invasive. We pass a very nice, small, thin tube down the male organ through the urethra, we see the prostate, and we're able to remove the prostate without making a cut, and then the patient is home in a few days, back to normal life.
I like the way you put it. Just easy and smooth.
Just easy and smooth.
The way it is.
But I mean, I'm sure it's going to be on everyone's mind. Can prostate enlargement lead to prostate cancer?
Yeah, so very important question, and the answer to that is capital no.
All right, that's a relief.
There are two different diseases in the same organ, and like I mentioned earlier, can happen in the same man. So in fact, that a man has prostate enlargement does not mean he shouldn't bother to check out his prostate for cancer. Every man who is above 50, in fact, recommended from age 45 amongst us African men should begin to get their prostate checked at age 45. And then after that, age 45, if everything is normal from age 50 on a yearly basis, you should get your prostate checked to be sure that there's no cancer. And it's very important.
Very important. Doctor, before we let you know, a very big thank you to you for joining us today. But how can they contact you at Evercare Hospital?
Yes, so we at Evercare, we're located at number 1 Admiralty Way, Bisola Durusimeti Drive, right there in Lekki. And you can reach us via website at www.evercare.ng. And our telephone number is 0813 985 0710. And if you can reach the hospital through that number, or email the hospital at info@evercare.ng.
Nice.
All right. Thank you so much, Doctor.
Thank you, Doctor.
It's been a pleasure having you here. For those who almost missed out on the show, we've been speaking with Dr. Ifedayo Adejare. He's a consultant urologist, and of course, he's with Evercare Hospital. We talked about so many things today. So, tell you what, like he mentioned, you can reach out to them on all the platforms that he's mentioned. Just call the number 081-398-50710 and also email info@evercare.ng.
You can also check out the website. It's www.evercare.ng. Again, www.evercare.ng. The location for Evercare Hospital Lekki is number 1 Admiralty Way, Bisola Durusumi Eti Drive, Lekki Phase 1. Call them up on 0813 985 0710. That's 0813 985 0710. Email them at info. It's info@evercare.ng. Again, info@evercare.ng. The Smooth Health on the Drive is brought to you by Evercare Hospital Lekki. Catch us every Thursday from 5:15 p.m. We give you the very best of healthcare. They offer you the very best of healthcare in Nigeria. Doctor, thank you again for coming on the board.
Yeah, it's been my pleasure. Thanks very much. I appreciate it.
And the Smooth Drive continues on the other side, Cardio.
That's right. There is something special coming through in the 6:30 hour. We'll be coming back to share that with you in a few more minutes. So please stay close.
In the meantime, more music. This is Smooth Drive. Smooth.